Every year for generations, winter brought not just snow and cold to remote communities in northern Ontario, it also brought the vital network of winter roads. But as climate change leaves lakes and land unfrozen, communities across the north struggle to replace these essential lifelines that bring in everything from groceries to fuel. Isadore Day is the Ontario Regional Chief, Chiefs of Ontario, Serpent River First Nation. Have a look.
There are approximately 39 First Nation communities that are remote, and about 31 of those communities are dependent on ice roads in the wintertime.
Ice road to Koshner, February 12th, 2011.
Our communities spend a lot of time preparing for those winter roads, but now because of climate change, it's so unpredictable. And this year alone, we've went from about 60 to 70 days of accessible ice road. Now we're only getting maybe 20 days out of that, if that, this year. We've got 3,100 kilometers of winter roads in the north that are a very complex situation and that require investment from the federal and provincial government to ensure that, possibly where there is the ability to build an all-season road, that work gets underway now, because the complexity of the issue is not just the cost of living and quality of life, but the accessibility for emergency purposes. And now that we're dealing with climate change, it certainly gives further complications and deepens the problems that First Nation communities are faced with in the north.
The Shoal Lake 40 First Nation straddles the border between Ontario and Manitoba. In 1915, the city of Winnipeg got approval to draw water from Shoal Lake from the Ontario government. With little regard for the area's Indigenous inhabitants, land was expropriated from what is now the Shoal Lake 40 First Nation for the construction of a water intake, which required digging a canal that cut off the community from the mainland. Shoal Lake 40 First Nation has been on an island ever since. Just 15 kilometers off the Trans-Canada Highway, today it remains accessible only by boat in the summer and an ice road in winter. While the Shoal Lake 40 First Nation sends water to Winnipeg, it's been on a boil water advisory since December of 2000.
Shoal Lake 40 First Nation has been on an extended boil water advisory notification because of the location of the community. You see, Shoal Lake 40 has been a man-made island for a number of years, since the turn of the 20th century, and as such has had to deal with the lack of water that's been conducive to safe consumption, and the fact that it is a man-made island. Even though they're only 15 kilometers from the Trans-Canada Highway, this puts them in a remoteness factor with obvious different characteristics of a remote community, leaving a number of challenges like the ability to only travel to the community via ice road in the winter or by ferry in the summer. And then there's the breakup and freeze-up period, which really leaves the community in a compromised situation. The bottom line here with Shoal Lake 40 is the fact that without the infrastructure of a proper road and the location of the community, the infrastructure for water just isn't there, and it's a quite costly situation without the road accessibility to make that happen. This year has been a really good year for Shoal Lake 40 in that the new Liberal government has said, listen, we're committed, we're going to do something about this. So you've got two situations with Shoal Lake 40. You've got no road leading to the community because this is a man-made island. That situation has to get cleared up. As well, all of the studies and all of the pre-feasibility for the water treatment plant, that's all in the works as well. So there's two major infrastructure components to Shoal Lake 40 that are now being undertaken in partnership with the federal government, and that's good news for Shoal Lake 40.
The 25-kilometer-long Shoal Lake Freedom Road is scheduled to begin construction in the spring of 2016 at an estimated cost of $30 million. But most of Ontario's ice roads span considerably longer distances, with some stretching for more than 200 kilometers. Among Chief Day's responsibilities at the Assembly of First Nations is heading up their national health portfolio. So we asked him about the connection between ice roads and medical care in remote communities.
The issue of ice roads is a very important element of ensuring that there's access to health care. For example, the capital aspect, being able to ensure that supplies can get into the north, to ensure that First Nations have access to the infrastructure that's required to deliver healthcare services, both prevention services as well as, say, moving from a nursing station to a full-fledged hospital in the north.
First Nation leaders from Northern Ontario declared a public health emergency on February 24th and are calling on the federal and provincial governments to intervene quickly before the crisis escalates. Leaders from the Anishinaabe-Aski Nation and the Sioux Lookout First Nations Health Authority, which together serve about 75,000 people, say unequal access to health care means treatable and preventable diseases are killing people in remote northern communities.
For the most part, throughout the year, the only way that an individual is going to be able to travel in and out of a remote community is if they have money so that they can get on that plane or they get sick. That clearly is a very constrained situation for the people in the north. We know for sure that if we have the proper infrastructure for travel, we will certainly cut costs, the travel costs that are required to get people in and out of the north, but we'll also be able to ensure that there's timely response to emergencies. We can increase the effectiveness of prevention programs, but we'll also ensure that we've got good quality and cost-effective healthcare services in the north.
For more coverage of the changing north and Ontario's ice roads, go to tvo.org/the Wheatham Road.
Help TVO create a better world through the power of learning. Visit supporttvo.org and make a tax-deductible donation today.